All right, so hello everyone. So my name is Dr. Sharir. I hope you can see my screen, just confirming everything. All right, that is great. All right, so please do confirm me in the comment section if you can see my screen. That's the very first thing. My name is Dr. Sharir. I've been instructor for last couple of years, almost 6 years it's been. So I've been teaching MC for certain long time, and also have been teaching PLAB for I think it's more than 4.5 years actually. So in MC side, we have almost if we count, the last month result, like it's over 900 just passed MC, and over 200 that passed PLAB. Why it's less in PLAB? Because we started it later actually. All right. A very important thing, in terms of the PLAB recall, often there's confusion, and what is the, some of the resources to study actually. So we'll get back to that part actually. Today's class is open link, so anyone, you can share this Zoom link to any of your friend. Also, you have a YouTube channel, so we are also transmitting that one into our YouTube channel. So you can also check that one. It's just after study, so it's very difficult to come up. So please do let me know, like, from which city you're attending this session. And, you can also at the same time, you can share today's Zoom link to any of your friend via WhatsApp or via Facebook Messenger and all this thing actually. So are you guys with me? So please do let me know, and please do comment in the comment section actually. Great. So we'll be starting in just 1 minute actually. Great. All right, guys. So there's a Zoom, chat box. I just want to make sure that, you can, see the screen, and, from which city you are attending the session. Please do let me know by a small comment actually. All right. So we can start like immediately once you just comment actually, guys. Great. So excellent. So looks like a good sort of doctors have been joining. So we hope so we'll have a good session today. Will not take much longer today. I mean, I hope so. It's not much difficult actually. Okay. So first of all, my dear doctors, you know how we are planning the sessions actually. So we'll just give you a small idea actually. Today is the 17th of April. So 17th. So this is April. We are taking the session, so 2023. It's the month. So 17th is today we're taking the session actually. So usually we take like a roundabout 2.5 hour session. Today it might be a little less because a lot of doctors have been taking interest in all these things. So it might be a little less today, but tomorrow it will be more longer session actually. So the time we are deciding is 7:30 p.m. Bangladesh time actually. So I hope so that will be good for many of you actually. So 17th April will be taking session, 18th April, there's 19th April. Okay, so these are some of the recall sessions actually. Then this 20th, 20th, there will be like theory sessions, will guide you on that one as well. Some of the like PLAB hot topics, will be guiding you actually. Also, all these are very, very important actually. And on 20, first, April, we are going to take a mock for you actually. All right. So this is how the things are done. No, now in this particular part, what we discuss are the latest, some of the recalls. So latest, some of the 2023, some of the last 2022. Now the question is about what about the other recalls, like last, the 5 years recalls actually. All right. So if you have already subscribed with us, like if you see there are a lot of folders that is given in our Google Drive, or by the end of the session, you have to be with us. I'll also give you demonstration of the folder, how it looks like. So in that folder, if you see there is a 2023 folder, then there is 2022 folder, 2021 folder, to 2000. Yeah, so like 2020, then also like 2019, and also even like 2018. So almost if you see that like almost 6 years of collection, and not only solved file, these are also with references. These are also with references that is given at the same time. Now, if you don't get time to see the video, so at least you can see the files and the references actually. in those folders, it is also associated with the video, because as I mentioned, we have been taking classes for last 4.5 years actually, right? So that means so many, classes and the folders, and it's just a, like, one time subscription actually. So example, if you have an exam on November, if you subscribe now, there's no problem. In PLAB, you can like keep continuing with us. All right, so no problem. So we take the session 4 times a year. Just giving you idea, we are taking this live session for PLAB 4 times a year. That means 4 times their exam, like, February, then there is May, then there is the August, and there is the November actually. So 1 month prior, usually we take the session. We are taking this session is April, so more targeting the May candidates, but many November candidates also, they'll be participating. People focus more on the recording so you can understand, but sometimes coming to the live is also good. All right, so 4 times, like, see, we already had taken session in the January for February candidates. Then this one is going on in April. Then there will be another one on the month of July, and the last one would be in this year. It will be in October for November candidates. So 4 times a year, you can just make payment one time, and you can just grab it actually. And you can, even if it is a UKMLA which is coming probably next year, you'll be also added to that one actually. So this is the, like, some of the ideas. So we take the sessions like almost like a 5 days, sessions we take. This is for the recalls part actually. This is for the recall part, just for more information. If any candidate is, like, example, say exam is in November, and the thing, we also do have theory courses, and theory courses does have the medicine, the surgery, then the pediatrics, then the gynae and ops, a very important psychiatry. People often fail because of the psychiatry. So all these particular things, the typical theory and the thing relevant to PLAB is very, very important actually. So those things are also available, if, but not for the May candidates. That is more applicable for if anyone's exam is in August, or anyone's exam is in November or next year actually. All right, so do we have these two types of courses actually in generally. One is that regular course. Regular course at least takes 3 to 4 months of time for total preparation, and their recall course. Recall course, at least we say 1 month is time, but it is best if you join us early, because you can imagine, if you want to finish almost like a 6 year, 6 year, we don't also recommend. We recommend at least 3 4 year you need to finish. Now, why recall and things are important, in recent time, what we have seen, the PLAB exam is getting harder actually. So if I give you some stats, a lot of doctors, they come to us after failing actually. What happens, most cases they are using very common, some of the things like, PLAB keys. I'm not selling their, but they're extremely good. So PLAB keys, PLABable. But one more thing to consider, that many of you coming from the background may not be the same. Many of you may not be the best student of your medical, but that does mean, like, are you a bad student? Not really. You all are good actually, I believe. Actually, it's just like technique. You are ready to deliver everything, but sometimes, this, like, PLABable keys, some cases may not be enough. If you have some clinical gaps, say if you start studying after 3 year or 4 year, you probably have, forgotten gynae ops. Right, you're working in a pediatric department, you have forgot the gynae ops. So in that case, you need to cover up this part. So only, finishing these things, some cases may not cover everything. All right. So we have seen, along with that one, when you use the recall altogether, its combination, almost like a 95% passing chance does generate actually. Now, if you include this, PLAB1, keys, then this PLABable, then this PLAB recalls. All right. At the same time, if you also include the PLAB theory at the same time, in case if you have more time, in that case, almost, we figured out, compared to result, like 98% chances of passing till date. We say the PLAB exam is bit, easy until proven otherwise. But what I feel, since 2022, say probably in the month of May, they start becoming little changing, in terms of the, question pattern. Okay, so question pattern has been little changing since then. And also we figured out, in since last November, we have very good result in the November, but throughout the world the passing rate a bit fall actually we have seen actually, and it is because they are improvising new questions actually. All right, so that was the reason we have to be alert. Our result, like shares medical result was good because we have been solving 5-6 years question, and in that is important actually. So when you solve at least like a 4-year question, that means you know what may come and you focus on those particular topics. All right, so this is very, very important. You have to be strategical. You cannot study all the things in the universe. You can read some of the good contents, PLAB quiz, PLABable, but not every time you can expect them to come in the exam. There are a lot of uncommon topics too in the main exams actually. All right, so you need to be focused on PLAB quiz, PLABable, but at the same time, I'd just like to add PLAB recalls actually. And how many years of PLAB recall is recommended? At least minimum, if you have very less time, if you're joining now, then at least finish, for God's sake, at least 3 years to finish actually. If you have more time, you should go for at least 4 or 5 years actually. And what we give is actually for 6 years video plus file plus solve contents plus mock, all these things are included. And please make sure out of these 6 years, at least 3 years, you should see the videos actually, if that is applicable. 3 years video means, in every year, like say 2022, so example, it has almost 4 months of collection. All right. So example, like there is a February exam, is another folder, then you'll find an May folder, then you'll find August folder, then you'll find November folder. So individual year has this kind of folder. Those of you already subscribed, you can go and check that one. All right, so that's how things are given actually. So please make sure you finish 3 years videos and at least try finish maximum file that is possible, because files also given references and things. Now let me go and figure out. But before that, if you have any question, I'd like to happy to answer, guys. If you have any question, you can also write down in the chat box, feel free, or otherwise I'll just take you to the solving question actually. All right, so this is the thing, guys. Great. I hope so you guys are doing great. Try to be a little bit more sporty by commenting in the comment section in the Zoom chat box. So it's great if you can do that. All right, I'm just taking a minute actually. If you can write something. Great, guys. We'll be start solving questions right now in a minute actually. If you have any questions by this time, please drop in the Zoom chat box. Thank you so much, guys. We'll be starting in just 1 minute, so we'll be starting with the questions. Okay, if no question, you can write actually, no question, please continue actually. So little participation will be nice, guys. Thank you so much. Thank you so much. We got no such question. I hope so. That's a good, idea or demonstration. Okay, let's go and start. If you think respectable doesn't matter, online teachers and the things, whenever, you are in any platform, you should always respect to anyone, so this should be, and this is where we located in Dhaka, Bangladesh. Our office is in 𝒃𝗟𝗃 area. You all are most invited to visit if you get time anytime. All right, so here we go with our first question for the first day. Let's just see, how it goes actually. All right, I think I'll turn off myself, or okay, let me keep it myself. It's okay. A couple who had a child with a cystic fibrosis needed to know the chances of another child having it. Both of them are disease-free. All right, so there's two child who is having it, and both of them are disease-free. So what do you think? What will be the percentage? So this is a very basic question. Often we see this question coming in the main exam. The question is the chances of another child is having disease. So you can jump into conclusion by adding A, B, C, D. Come on, guys. I hope you can do that. I hope it is not a difficult question. I can see a couple of doctors, but that is how we proceed actually. You think something, then we proceed actually. So cystic fibrosis, think in that way, it is autosomal dominant or autosomal recessive or X-linked. Then think in that way, if it is this chromosomal association disease or something, then what is the percent of the offspring to get affected? If it is 25%, then 1:4. If it is 50%, then 1:2. That is the thing, right? So let's go and find it out. What is the answer? The answer is 1:4. We all know for autosomal recessive, it is like a 25% chances of offspring to be affected. So 25% means 1:4. That was the easy question actually to start with. We have also seen a question, and let me show you something interesting. What we were discussing right now is here. Okay, so this part is here. That a carrier mother crosses with a carrier father. In that case, 25% chances of one offspring fully get affected, 25, and another 25 will be carrier. Okay, one of them would be totally normal. I hope you get that. So this is the basic, 25% chances means what? Now, we have seen in another particular year, probably if you see the previous question from our collection, then there was another question. It was mentioned that, diseased mother, the same question, they will tell you one thing, cystic fibrosis mother. There was a line written, cystic fibrosis mother. Now, cystic fibrosis mother and carrier mother are the same thing. Not really. Cystic fibrosis mother, the whole scenario can change. Now you see this, mother has cystic fibrosis and father is a carrier. Is the result is going to be same? Please let me know in the comment section that is the result is going to be the same as like the before, this 25% previously was affected. Will it be still the same 25% offspring to be affected? No, not really. Now we can see 25 and another 25. When you cross them, 25, another 25. So 25, 25, 50%. So if it is a diseased mother crossing with a carrier father, in that case, 50% chances. You see, this same question answer can be 50% or 1:2. This is an exam question, by the way, guys. All right. And the remaining would be the carrier. So remaining would be the carrier. There is no normal child in that case. Are we clear, guys? I hope so it is here. So isn't it a fantastic question? Actually, it can come. So please be aware. My job is not to tell, this answer this and what has been tested before. My job is also to tell that actually. So this question has been tested already in a one of the exam. I think it is in 2022 beginning question, one of them. Great. Okay, moving forward, I hope so it is clear. Please do let me know in the comment section if you are clear so that we can continue. All right, a little bit, your sporting attitude would be really nice here actually. All right, moving forward, a little bit more information about cystic fibrosis from our collection and the notes section. This is autosomal recessive. Autosomal recessive means 1:4, that is 25%. Number one culprit, this is the exam question. Previously, it's been tested. So this is Pseudomonas. I repeat, Pseudomonas. Okay, it's number one culprit. I was watching a video another day. I saw a small kid is crying, and she's very angry with the hospital authority. Why? Because she has been taken every day. Brought to the hospital, and she has been given some gas and things like that. So actually, what was given? Did you know that there is a way of delivering antibiotic through inhalation form? How many of you know that? So there is a drug called tobramycin. Tobramycin is given, if you see the Davidson medicine, it is given in inhalation form. So small, that kid, but still she's angry, even though needle is not given, but every day going to hospital is difficult. Cystic fibrosis, fate is not much good. We all know that, because eventually they will die because of respiratory tract infection actually. And what is that culprit? Is most cases this cystic fibrosis. Second, another common is a staph aureus actually. If I ask you something interesting, that cellulitis, this is the exam question by the way, guys. In cellulitis, what is the number one cause actually? Is it a streptococcus or is it a staph? Strep or staph? What do you think? So Staph aureus or streptopyogen for cellulitis, guys. This is the exam question. As I said, my job is to ask you actually. So this particular thing. Come on, guys. So what do you think? Staph aureus or strep pyogen? Final answer, final call, guys. Come on, try it. Final answer is a streptopyogen. Number one, streptopyogen for cellulitis. This is a very common mistake, guys. Streptopyogen for cellulitis. This is the exam question. All right. Coming back to this one, cystic fibrosis, how do we confirm it? We confirm it by sweat chloride test. We all know that chloride channel has a defect. Normally sodium to enter inside the cell. Now they are not entering, they remain outside. So we sometimes call cystic fibrosis as a salty baby. All right. This is another thing. Now, there will be repeated respiratory tract infection and other system is also getting affected. All type of secretion is get affected in cystic fibrosis. And did you know that? Decrease, respiratory tract infection, more cough, decrease bile or bile get concentration, gallstone, then there is a concentrated seminal fluid, gives rise to infertility, less, fluid in the bowel, so there will be eventually rectal prolapse and also malabsorption because pancreatic secretion also get affected. So malabsorption. So, we can correlate a lot of interesting things like that. All right. Now, last thing, this is the treatment. How we treat, it's a supportive treatment. Prophylactic antibiotic is very important. We have seen with infective endocarditis, we give prophylactic antibiotic, right, to prevent infective endocarditis. The same in cystic fibrosis, we give supportive treatment, but at the same time, we also give prophylactic antibiotic. And the specific treatment is N-acetylcysteine. N-acetylcysteine. Please keep this in mind. I hope you are okay. We can move forward to the next slide, actually. All right, guys. I hope so you're enjoying. Let me know if you are bored. Okay, 40-year male passing a 6 to 8, stool per day. Temperature is 38.8, and he is tender in the right lower quadrant and has an anal fistula. Choose the single most cause of abdominal pain. So you have 5 options, and you have 15 seconds to answer this. Come on, guys. You can choose as A, B, C, D, E. You don't have to write the full form. Think in that way, some interesting way of thinking. The key word, let me tell you, is anal fistula here. The key word is a anal fistula here, actually. This is the hint here. I hope you guys are talented. You guys are guessing it. So, let me introduce inflammatory bowel disease. Among inflammatory bowel disease, which one you would pick up? Is it ulcerative colitis you want to pick up or Crohn's disease you want to pick up? I'm pretty sure you guys are very talented, so you're going to pick up the Crohn's disease here. Because in Crohn's disease, you can see this is a, bit, you see, this is, we call it transmural. That means if you see the thickness of the bowel, it's like a very narrow in case of, Crohn's disease, which is much bigger in case of ulcerative colitis because of the transmural. Transmural means all 4 layers are affected. So this is Crohn's. So in which case do you think complication is more common? The one with a narrow lumen or one with a more wide lumen? I'm pretty sure you are thinking the one with a very narrow lumen. With a narrow lumen, more chances of obstruction. So with the Crohn's, more chances of complication. With Crohn's, more chances of complication. These are systematic disease, inflammatory bowel disease. Both Crohn's, ulcerative colitis has, multi-variety of complications, but still some of these bowel complications are more common with Crohn's disease. All right, so this is particularly. Now, coming to the question, nice thing, why temperature is high? Because you can see in this particular picture, there's something is written. Like, see, again, if you see the Davidson medicine, Crohn's has 2 or 3 varieties, right? One of them is a Crohn's colitis. Have you ever heard this name? Crohn's colitis. So Crohn's colitis, if you see, which can be associated with more higher rise of temperature. Okay, so that will answer and explain that one actually, like Crohn's colitis. So now, which is that this particular picture. So this particular picture is here, Crohn's colitis. All right. And you can see some of the appearance and things are given here. This is Crohn's disease, it's like transmural, normal Crohn's ulcerative colitis, which has a lot of ulcer. We can see ulcerative ulcer, right? So this is the thing. Great. I hope you understood now. Great, guys. Like, if you want to know more about the Crohn's colitis, details not much necessary. If you just know the name Crohn's colitis can be associated with a bit raise in the temperature, it will be more than enough. But for more details, you can see the Davidson medicine has mentioned 2 or 3 different types of Crohn's separately. It's a very big, detailing thing about the Crohn's disease, ulcerative colitis, lot of research and thing. Someday you can go to the NHS and definitely, you can put your research on inflammatory bowel disease, inflammatory bowel syndrome, lot research is going on, I can tell you. All right. So this is like few of the things, stipulation, present, stipulation, absent. I think there's, the lumen size is also important. We can also say the ulcers can be deep, ulcers can be superficial. Pseudopolyp is present here. You can see this thing, pseudopolyp. We also have seen in the last picture that, some of the pseudopolyp, yeah, here is a like pseudopolyp, which is present here. All right. So I think you can see it, that file and the things, and I think you can guess it actually. All right. We can move forward to the next one. If I before moving forward, if I just want to know from you in one line, what is that initial test you want to start? What is that initial test you want to start for Crohn's disease? This question also been tested in 2000. I think in 2021 it is tested. What is, they give a scenario and we're asking what is the initial treatment in case of Crohn's? What is your answer in that case? Come on, guys. You have to be quick a little bit here. Anyone? Okay, see, corticosteroid is never an initial treatment. Always remember this. Corticosteroid is a treatment for acute phase. Acute phase. If they mention this is an acute phase, reaction is happening, then for any autoimmune disease, any condition, that is the corticosteroid. But if it is a generally disease, things are given, then you don't have to go for corticosteroid, always choose sulfasalazine in that case. Acute feature present, corticosteroid. Acute feature not present, talking about initial treatment, sulfasalazine. Is it clear, guys? Is it clear, guys? Please do mention in the comment section. Is it clear? So next time, please do check the questions, probably choose sulfasalazine. Then what's next? If I ask you, now, my interest is going towards, I thought that you guys know that pattern of the treatment. First line is a sulfasalazine. What is that second line? Sometimes they'll give you sulfasalazine given, not working. Then what to do? Of course, you have to give a treatment. Sulfasalazine given, not working. All right. Or maybe a male patient, giving sulfasalazine will have, azoospermia. You can't give that one in some cases if they're planning to do a family. So in that case, what you will give? A second line of management. What is that second line of management? Now, in that second line of management, you can go and choose some of the things like methotrexate, MEMTX, right? Methotrexate can be some of the second line of treatment. Guys, book to book thing can little vary. You can check from the NHS guideline in that case. Secondly, thirdly, what is the last resort? Guys, in this type of major diseases, this is a very common practice. What is that last resort? All right. So what do you think? Yes, you guys are trying. I believe you guys can. So first is a sulfasalazine, second is a methotrexate. If acute flare up, then steroid. What is the last resort? I can give you a hint. It's called TNF, a little bit hint. TNF actually. Okay, you can see that one by going to the books. It is also mentioned in even in PLAB on keys and all these things, guys. You have to remain these things, keep this thing in your head actually. All right. So what is first line? What is second line? What is third line? Yes. Well done. Someone mentioned as a 𝒃. So well done. So you have to go in that way. You have to go in that way, guys. You have to study hard, guys. That's why, these things are important. Next thing is coming is a question number 3. Okay, we just move forward so that you can cover up more. 64-year man been waking up in the middle of the night to go to the bathroom. He also had difficulty in initiating micturition, complaints of dimpling, diagnosis is BPH. Was made after transrectal ultrasound guided biopsy, and patient was prepared for a TARP. TARP is a procedure, right? Transurethral resection of the prostate. Which electrolyte abnormality is likely to be due to this surgery? Okay, you need to answer this quickly. This is an easy peasy question, often comes in the main exam. This is an easy peasy question. So in that case, the answer is everyone knows this is the answer, hyponatremia. After this procedure, and this is the explanation and the things are given. Let's see and keep eye on that explanation. Absorption of the fluid used for the blood irrigation to flush out the blood clots and IV all may lead to hypovolemia, delusional hyponatremia. This is the explanation. So final answer is a hyponatremia. All right. Let me ask you something. There is a condition named SIADH. You heard this thing? Definitely. If there is SIADH, what are you expecting? Hyponatremia or hypernatremia? Quick question. If there is SIADH, what is SIADH? SIADH means syndrome of inappropriate ADH, means high ADH. If high ADH, then what? Are you expecting hyponatremia or are you expecting hypernatremia? So your answer time is finishing, guys. Come on, hurry up. Come on, guys. 5 more seconds. Final answer is a hyponatremia. Guys, these are exam relevant questions. SIADH relevant thing, hyponatremia. If hyponatremia, there is seizure. That means, any SIADH patient can be presenting with a seizure feature. Okay, a quick question. Any SIADH patient can be presenting with a lung cancer. Is that possible, guys? Any SIADH patient can be presenting with a lung cancer. Is that possible? Definitely that's yes. Because you see, which lung cancer? Now, a lot of questions are coming. Small cell carcinoma, squamous cell carcinoma, adenocarcinoma. Which one? So it is 𝗔𝗔𝒐. This is the popular again in the exam with a small cell carcinoma. Two things, SCTH and the ADH. These are the two things are called what? Two paraneoplastic features. So these two paraneoplastic feature, this one is related to small cell. Okay, so they both are related to small cell. This is ADH. This is our case. So this SIADH can be associated enormous secretion of this ADH. So this is interesting. Right? So keep this thing in mind. In many way question can be tested, guys. This is why the important you need to see our previous videos. I've explained all this thing in different questions. This is a tested another question with SCC. Every year question has been tested with small cell cancers actually. Okay, quick question. I'm very happy that you remember that ACTH and ADH is related to small cell cancer. Now, can anyone explain, like, for squamous cell carcinoma, squamous cell carcinoma of the lung, which paraneoplastic feature is you are looking for in the exam? Which paraneoplastic feature you are looking? I'm making it much easier. Exam would be more difficult and different way it will come. So I'm asking more, clear way. Squamous cell carcinoma, what paraneoplastic feature? Guys, you have 10 seconds just. These things, is have to be in the tip of the tongue. So squamous cell carcinoma, what do you think, guys? Last call. Okay. For this one, have you heard about the calcium related thing? Calcium goes up because of what? Parathyroid. So PTH related anything? PTH related anything? Is it interrelated? Yes. So PTH, something interrelated. Parathyroid. So parathyroid, it can be a paraneoplastic feature for squamous cell carcinoma. Clear, guys? I hope it is clear. So remember this paraneoplastic, everything related to lung. Patient presented with chest discomfort, hemoptysis, chest pain, and little bit and coming up with a hemoptysis, very high chances can be a lung cancer. Also, they have a different pattern of cough at the same time. It can be lung cancer. All right. Great. So for the procedure, like is TARP. TARP is done for different prostatic cases, and see prostatic cases. These are some of the procedures. You need to know when is medical management and when is surgical management. This is how it's been given. So some medical management of TARP is given. As you can see, alpha blocker can be used, 5-alpha reductase inhibitor, another drug which will shrink the prostate, which is good, and bladder, which causes muscle relax, so there's more water will come out. So anticholinergic. So these particular things can be useful in case of benign enlargement of the prostate. All these individual drugs, they have their own side effects. All right, especially anticholinergic and 5-alpha reductase inhibitor, they have a lot of side effects, especially 5-alpha reductase. Finasteride and dutasteride, these drugs has a lot of side effects. All right. So benign prostatic hyperplasia, a little bit information. I believe you guys already know it. Difficulty starting urination. There is a symptom we call in general these things as a LAT symptom, lower urinary tract, symptoms and all these things. We do DRE testing, and after the DRE testing, we found smooth, regular, but enlargement can be detected. But if it is irregular size, border, and all this thing, in that case we think this is a prostate cancer. Very, very important. Ruling out BP versus the prostate cancer. Right? These things are important. So see the risk factors, see the symptoms, see the diagnostic test. We do DRE and PSA as in some of the initial, but there has to be some gap. We don't do DRE and immediately we don't do PSA, because just immediately doing DRE can alter the PSA. All right. So this is something too important. And later you can do ultrasound, and finally you have to do biopsy. Please remember the ultimate test is biopsy. All right. Keep it in mind. All right. This is an exam question, so that's why I just put in that way. Tamsulosin can cause dizziness and postural, drop at the same time. This is how a question has been tested. Tamsulosin can cause dizziness and postural drop. Okay, so keep this thing in mind. This is how question can be also tested. This is how question can be also tested. Great. So well done, guys. Actually, next question. A 70-year-old woman on paroxetine and increasingly become weak and confused. All right. What is the single most likely reason for her confusion? Let's see, how you come up with. So paroxetine is a what sort of drug? First, figure out that one. Then start thinking about the findings. All right. Guys, you have 5 more seconds. Please hurry up. Okay, let me reveal the answer. In that case, the final answer is a hyponatremia. Hyponatremia, actually. All right. So this is the thing. Hyponatremia occurs in patient with paroxetine, even the therapeutic dose and in overdose. This is the NHS link. Okay. Answer here is a hyponatremia. This is not a new question, guys. This is also been tested in past, actually. So that is important. You need to keep eye on the other recalls, actually. Very, very important. All right, very, very important. Now, see, let me tell you one thing. Sometimes in some question, like, two of them can be very similar. Two of them can be correct. Among them, the one that is more common, you need to figure out that one. The one that is more common, you need to figure out. So a lot of question can come in that way. Lot of question can come in that way. So please keep this thing in mind, actually. Great. There's some extra additional slide, you can check the slide immediately after the class, so you can go through it. Some side effects and things are given, but remember this one, hyponatremia is the answer in this case. Next question coming up. Patient after thyroidectomy, perioral tingling sensation and irritability, and asking about cause. Some labs are given here. The calcium is low, normal, potassium is low, normal, and yeah, so this is the range. Bicarbonate is increase. So what is likely to be caused in this case? So after parathyroidectomy surgery, these things are happening, right? So let's figure out something for this one. We can see we have a lab here. All right, so in this case, the high likely, the answer in this case is D, perioral tingling links to low calcium. So perioral tingling sensation is indicating low calcium level. You guys are absolutely correct. Very good answer in this case. So D is the correct answer. So post thyroidectomy complications, these things to keep it in mind, immediate or some earlier, some bleeding related some complication, which bleeding can also lead to some difficulty in respiratory. So there was a question also, I remember, like, after that surgery, the patient, some feeling some choking. So what you do next? You remove the superficial stitches. Have you ever heard about this kind of question? The patient is feeling choking, immediately after the surgery, you need to lose the superficial stitches, right? Because of the hematoma can develop in this particular side. Next is a hypocalcemia, which we just now discussed. There can be permanent hoarseness after this, very common after this type of surgery. So please keep these three things in mind, actually. Reference NHS website. So you can totally believe NHS website also gets updates regularly. Any questions, guys? I just want to be sure. Please, if any question, please ask. Otherwise, please type, please continue. Thank you so much, guys. Next question. Patient with a history of travel since 7 days from Thailand. Now shortness of breath, left-sided chest pain, and you can see the temperature is 38. Pain increases with cough and inspiration. Okay, so what is your diagnosis in this case? I mean, I think this is supposed to be an easy question for this exam, actually. I'm sure you don't need even 10 seconds to answer this one, I'm pretty sure. All right. I can see many of you are started answering as a A. Well done. In our country, I think most of you are from Bangladesh, so there's a very nice thing available if you go to the village areas. What is called bamboo? We call bash. Now, coming to that part, actually, fun part, I'm sorry if anyone feel offensive. Now, please see this question. You're focusing on the pneumonia. You're focusing on the pneumonia. Now, few things: pain increases with cough and also with inspiration. Okay. What is the explanation of that one? This is a very interesting one thing. Now the temperature is here. Is this temperature you call as a high temperature for pneumonia? Is it high enough for pneumonia? Firstly, not really, right? It has to be at least 39, most cases. It is not really, that high temperature, so that's the thing. Costochondritis is less likely, probably after this kind of tour and the thing. If you go for pericarditis, okay, if you go for pericarditis, in that case, what do you think? What is your explanation on that one? Quick question, can it be MI? The intensity of pain and all this, it doesn't really look like MI. So MI is out from the option. Pulmonary embolism. We have a travel history, like 7 days from the Thailand. Now shortness of breath, left-sided chest pain. Left-sided respiratory temperature, pain increases. Pain does not increases with cough. B is out. Okay. B is out. No, not really. You can travel. I travel all the time. Doesn't mean always, I do have pulmonary embolism. Most chances that I might get flu. All right. So this is another thing. Thirdly, I might get more chances with, or anyone can get more chances with bacterial things or viral things. Now, how many of this condition can be associated with virus? One is a pneumonia, which can be associated with virus. Another is a pericarditis, can be associated with virus. Pericarditis associated with what virus? Anyone? Have you ever heard about the, 𝗕𝗂𝒃 virus? Definitely, that's a yes. Now, the last line, the pain increases with cough and inspiration. Is this thing is matching with pneumonia? Very important question. Not really. So pneumonia is out in this case, like not with both actually in case of pneumonia. And also you can see the temperature, which is supposed to be more higher. All right. In pericarditis is reasonably high. This is the thing. In pneumonia, it is supposed to be more high. All right. So with that note and all this thing, we think this question is more related to pericarditis. Pericarditis, right? Complicated the answer, but this is the thing. This travel thing is for distraction here. Clear? Main line, always check. Some cases they might give you this kind of thing. Another important parameter you might find in the main exam: pain increases lying flat. Did you know this information? Pain increases lying flat in case of pericarditis. Did you know this information? I hope so. It is a yes. Pain increases on lying flat. This is for the pericarditis. All right. In pneumonia cases, mostly comes with an X-ray and things like that, like a middle lobe pneumonia, things like that. It's very common, and they will be giving you features like pleuritic chest pain, then high fever, this that. So it's quite classic in case of pneumonia. All right, so that's like a pericarditis to me. Great. So in case of acute pericarditis, so this question has, I would say, little less information. I'll give you guys benefit of the doubt for this question because the question itself has less information. But in main exam, when you go, you might find it more complete and you can able to answer more clearly. But do remember this some of the parts like temperature and some of the last line, which is more matching either with pericarditis or either with pneumonia. Clear, everyone? Great. This is pericarditis. Some information cause chest pain with pleural rub, then pain increasing with lying flat or inspiration. Diffuse ST elevation. This is another feature of pericarditis, which is in case of MI reciprocal, viral often Coxsackie virus, and how you treat this condition is giving an NSAID. Everyone clear? So main etiology, if you see, is often been the viral. So viral is often been very common in this case, actually. So viral uremia, that means chronic kidney disease, and you treat with painkiller NSAIDs. If necessary, you can also give steroid. Do you have any question, guys, or you can write continue? In that case, feel free to ask. Or if you want to defense this case, feel free to also defense. All right. So thank you for asking. To continue, thank you. For next question, we're going. 33-year-old man involved in a street fight presents with a bruises and deformity in the upper part of the leg, X-ray showing fracture of the neck of the fibula. What is the single most associated nerve injury? A, B, C, D, E, actually. What do you think? This is B, actually. Okay. So A, B, C, D, E. So what do you think about the correct answer? Keyword: deformity in the upper part of the street fight, deformity in the upper part of the leg. Fracture of the neck of the fibula. Quick question, guys. You have 10 more seconds to answer this one. Come on, guys, choose one. Neck of the fibula. I think it's more like an anatomy question, guys. No, why it would be sciatic nerve? No way. It's sciatic nerve. It is already mentioned, guys, fibula neck. There's only one nerve, near to the fibula neck. Which one? I think it's a very straightforward peroneal nerve. See, our professor, I remember in anatomy, used to teach if there is a motor bike accident, what happened? Your fibula get hurt, and if your fibula get hurt, there'll be peroneal nerve, like a foot drop. All right, so lateral peroneal nerve is also nothing but a superficial peroneal nerve. So D is the correct answer. Very short answer. Okay, so if peroneal nerve get affected, peroneal nerve affects the foot eversion. Tibial nerve affects the foot inversion. Please remember this mnemonic. Please remember this mnemonic. So guys, when you go to the main exam, they will try to test you peroneal versus sciatic nerve versus L4 versus L5. Right now, those of you already subscribed, I will share today. There is a video of mine with a nerve root that will clear all of your doubt, like L4, L5, S1, peroneal, and then there's a C1 to C5, like C5 and T1, all those things, and also the brachial plexus and some of the nerve root related confusion. Right, it's often confuse us, all of us, actually. So it's very important. You see that video. I'll be sharing just after the class. Very important. In different classes, I'll tell you certain important thing, actually. Or in case if I forget, guys, please do remind me to share that one in our messenger group which we just made, actually. And here is that thing. This is a very important chart, actually. But in that nerve root video, you will find that explanation, like peroneal versus sciatic versus L5 versus, like brain stimulation, how you can differentiate with each other. Very important. So you see the inversion. Okay, this is a very key thing, like inversion actually, and ankle dorsiflexion. So these are like some of the important. Ankle dorsiflexion foot drop is common in all of them almost. Okay, so all you need is a solid evidence for if there is any foot inversion. You see in peroneal nerve, the foot inversion is spared. I mean, it is totally fine. Whereas in others, sciatic, L4, cortical, it is affected. So this is a big way of differentiating each other actually. Moving forward to the next one. 3-year child, with was wasted on examination. I mean, wasting in the examination. History of diarrhea on and off. Mother describes the stool as bulky, frothy, and difficulty to flush. What is the single investigation most likely to lead a diagnosis? You have 5 options. You can see A, B, C, D, and E. You choose one. I'm sure you can do well. 3-year child with diarrhea and stool has some finding. What is your testing you want to do? Okay, many are answering this thing as a sweat chloride test. Okay, it can be anything actually, guys. Now, let me tell you something. Those of you who are choosing A, you are thinking about cystic fibrosis. Those of you who are choosing this is B, you are thinking this is as a celiac disease, isn't it? Liver function like hepatitis or something like that. I don't think so. In jaundice, we have this is out. Ultrasound, okay, good test. You can do it. Maybe question mark, but not really relevant here. I don't see any thyroid related issue, so that is out. Okay, so 2 things remains, and these 2 are the bigger confusion actually, like celiac disease and cystic fibrosis. Did we know that in cystic fibrosis there is a term called a failure to thrive? You heard this thing? I'm sure it is a yes. So is there any failure to thrive in this question? First of all, you see any failure to thrive? A quick question, quick answer will be appreciated. The answer, no. Is there any repeated respiratory tract infection? Let's again figure out. Is there any repeated respiratory tract infection? Again, no. All right. These are the 2 main features often comes in the main exam. Now you must be more thinking about the wasting. So wasting can happen with a lot of things. So wasting can happen in all of those cases actually. Anyone who is having deficiencies and the thing for a while, it can happen with time actually. But 2 major things to diagnose a cystic fibrosis, one of them is failure to thrive, and then was a repeated respiratory infection. A single word is not mentioned about respiratory infection. So, and whether the diarrhea thing is diarrhea can be present in both, but on and off diarrhea, this is also more common with possibility with celiac. All right. So please keep this same thing in mind. This is a case of in celiac. So what is our test here in case of celiac? Anti-endomysial antibody. So moving you to the next one, celiac disease. So you see a lot of things, a lot of these features actually. Okay, I hope so in main exam when you go, you will find more relevant features. They will give you more. So bulky, frothy, and these things, why it just happened. The reason behind why. Because normal intestinal epitheliums are, we call it villi. But in celiac disease, in celiac, your villi are like this. We call them blunt villi. Now, do you think the same absorption will happen? No. So same absorption will not happen. So that's why there is malabsorption. Correct? Short end of villi, blunting of villi. Okay. So it is also known as in Davidson medicine, there is a separate box, subtotal villous atrophy. Correct? So this is the particular thing, celiac disease. Celiac disease. This is like that villi that get affected. Gluten. Now, gluten, I call, there is a thing called brow. What is brow? Barley, rye, oat, wheat. So if you give any of this type of food, in that case, like as an example, bread. If you give them bread or things like that, which has like the barley, rye, oat, and all wheat. All wheat is present. So simple, that bread and things are given. In that case, it will start working on this villi. Okay, so that's why, if you go to many restaurants, like, I live in UK, so uh, going to many restaurants, they offer this thing that, gluten-free diet. It's also available nowadays in our countries, not in the cheap restaurants, but in the expensive ones. Actually, they wrote in bold that, right? Like gluten-free diet, lactose-free drink, lactose-free coffee. These are very common actually. So this is the initial treatment for celiac disease. Like, give gluten-free diet. If not working, then Dapsone. So initial treatment is a gluten-free diet, number one. Number two is a Dapsone. I hope so you know that. A little bit more information regarding the celiac disease. So you see anti-endomycelial antibody, transglutaminase. These are some of the tests. But what is the accurate test? None of them are accurate test. Accurate test is a this is small bowel biopsy. I hope you know that, like, the small bowel biopsy or duodenal biopsy is some of the initial test. Correct? And if you see that subtotal biliary atrophy is not only the features of celiac, but dermatitis herpetiformis, giardiasis, radiations, Zollinger Ellison, it can be present, right? For now, we only remember the celiac disease would be good. Great. So couple of autoantibodies, but confirmatory test is a duodenal biopsy. Some pathophysiologies are given. It really doesn't come in the exam. How it come and involve really doesn't matter. Intolerance to brow. In one word, we remember intolerance to brow. Any questions, my dear doctors, or should I continue actually? Please do let me know if any questions in your mind. Or you can write continue actually. Celiac disease, again, a systemic disease, GIT symptom can remain asymptomatic, but also multi other system involvement. But most important is to know what are the investigation of celiac disease. So initially the blood test or antibody test, confirmatory biopsy. Well done, guys. 7-year child came with a wheeze after playing on examination, diffuse wheeze. How to make a diagnosis? He said, how you make a diagnosis. Is ECG for 7-year? Not interested much. X-ray with wheeze, much can be done. Okay, 7 years. So X-ray is probably, you can think about asthma and all this sort of thing. You can keep this thing in a mind. Possible. But is it the best, or spirometry will be the best? Is X-ray would be best, or spirometry would be the best? Surely spirometry would be the best. Now, let me ask you something. If less than 1 year, like bronchiolitis, which is less than 1 year, which is caused by respiratory syncytial virus, not paramyxo. Paramyxo is a feature of crop or croup, whatever you say, we call croup, but many people say crop, it's in that way. So it's actually croup. So respiratory syncytial virus, bronchiolitis, less than 1 year. Now, in that case, what is the first initial test? Okay, X-ray, nasopharyngeal swab. What do you think is the initial test? Another one is a blood glucose. Okay, let me give you 3 options. So answer for this one is that this is the first line. First line, nasopharyngeal swab. Even in terms of X-ray, it is written, that it is not much necessary. So nasopharyngeal swab for bronchiolitis, compare and contrast. Sometimes I use this word, compare, contrast. Pertussis cases. Pertussis cases, we also do the same thing. Nasopharyngeal swab. We do blood glucose test, in which case, in very sick kids, somebody will go for the clinical exams, right? So in that case, you really have to, from your mouth, it should come out blood glucose if the kid is, say, sick. Very important. All right. So we choose a spirometry. This gold standard. Okay. Sometimes you might see a arterial blood test related test. 30-year-old lady presents to an accident. Emergency department with shortness of breath and difficulty in chest pain and feeling if she will die. You decided as a doctor to do arterial blood gas, which is a good decision. Whenever you see hyperventilation and situations like that, it's very wise to do an ABG if the vital is getting affected. Which abnormalities you might find in the ABG? All right, you have 10 more seconds to answer this one. Guys, whenever you have hyperventilation, what do you expect? Metabolic acidosis, metabolic alkalosis, respiratory acidosis, respiratory alkalosis. In this case, you see the explanation is given here. Please check the yellow box. Let me highlight this yellow box for you. The key is A, high pH, low carbon. It's mostly a panic attack, hyperventilation. So hyperventilation, respiratory alkalosis, which causes high in the pH and low in the carbohydrate. Due to low in the carbohydrate, because carbon dioxide to wash out. Like if you do, forcefully by panic attack, this carbon dioxide things will be washing out. I hope that is clear to all the dear doctors. Okay. Moving forward, guys, please do remember, whenever a case of hyperventilation, I mean, talking about the previous one, hyperventilation, two things can happen. One, metabolic acidosis, and second, metabolic acidosis and respiratory alkalosis. These two conditions can be associated with hyperventilation. Then you see the question, then you decide, which symptom is more relevant to the conditions actually. Next question. 60-year male recently recovered from myocardial infarction. He is anxious and features of depression is present. How to treat his situation, my dear doctors? So this is like a recovered from MI, post-MI case. This is a post-MI case. Is it common after MI depression? Yeah, that's quite possible. So if there is post-MI depression, what sort of drug would be more useful actually? So in that case, actually, answer is a sertraline, guys. No way, paroxetine, no. It is sertraline. Post-MI complication, depression, sertraline is the choice, my dear doctors. Okay, guys, you need to study a little bit more, especially with the first line, second line. Those of you already subscribed, please check out those 150 very high yield cases where we were discussing the MI and post-MI complication and a lot of things. So there's like, few hot questions out there. First line, second line, we are discussing in those theories very well. So those of you just now join, of course, you'll be finishing the recall side by side and also checking with the 100 those 50 cases will give you demonstration. Probably not today, maybe second day will give you the demonstration on that one. All right. So very, very important, this kind of first line, second line, this is the things they want actually, because it's not really written in the guides and the things. Because we know it from the practice and all these things, so we can guide you on that one. All right. So, but very, very important if you can know those things, because a very specific question, post-MI depression, actually, unless if you know, otherwise it's very difficult to, just assess and gauge actually. All right. Now, a few more other things about the post-MI complication. Let me just guide you in my way. All right. Now, in this sort of cases, let me just figure out actually. All right. So in the post-MI complication, topic is a post-MI complication. I'll try to ask you a few things and you'll try to answer a few things actually. Correct? Now, what is the sudden cause of death soon after MI actually? Guys, please try participate. Guys, please try participate. What is the cause of death in most cases? You have to just have one shot here. Answer is a ventricular fibrillation, which is a sort of arrhythmia. VF. Well done. Most of you are correct. Well done. If you say arrhythmia, that's also correct. Now, if there is a, some sort of murmur 3 days following an MI. Okay. What is the cause of that one? 3 days following the MI, now there is a new onset of murmur. Diagnosis, please. You have 5 more seconds. In that case, answer is a papillary. I hope you're writing, guys. Muscle rupture. Good. Great. Next thing, if there is development of fever on the 5th day of an MI, and the patient is also complaining of chest pain, which increases with inspiration or more on the lying flat. So in that case, 5 days after the MI. So in that case, answer is a pericarditis. Now let me tell you the differences. Pericarditis and wrestlers, like, if it is a fever and chest pain after 15 days of MI, which is like a 2 weeks after the MI, now it is called what? Now it is called Dressler syndrome. Great. Next, patient develops shock 48 hours after the MI. Patient develops shock 48 hours after the MI. What type of shock is that? It is very simple. Or they might tell you patient is deteriorating. Patient is deteriorating 24 to 48 hours after the MI. Okay, so this is a shock feature. Why? What type of shock? So that will be cardiogenic shock. Cardiogenic shock. Now, how to treat cardiogenic shock? You want to give lot of fluid, correct? In cardiogenic shock, you want to give lot of fluid. Or is that a correct statement or wrong statement? No, we really don't want to give a lot of fluid. You literally kill the patient in that case. You better give, drugs like ionotropes. Everyone clear with that one? We better give drugs like, ionotropes in that case. Correct? So these are a lot of, interesting things you need to figure out as a, post, MI complication. And if there is a palpitation, a lot palpitation after a MI case, say example, 2 days after MI. So what is that condition? And this is actually MC, means most common. So what is that particular thing? So a lot of palpitation, why it is happening? It is nothing but the very typical arrhythmia. So I wrote the last, most common little late, that's okay. So, but arrhythmia is somewhere the most common among the all of them, correct? Arrhythmia is somewhere one of the most common of all of them. So I hope you enjoyed this part actually, about the MI related and some of the other things related, correct? Great, guys. So let's move forward. Or you want me to hold here for a few seconds? It's okay. We can hold here for 10 more seconds actually. Yeah, the same thing, same thing. Looks more easy, I guess. This was the question. So post MI complication, and we can say 1 month after MI, if person is feeling lonely, sad, lack of appetite, fear of going out, fear of death, and all the features. So patient is suffering probably depression, which is quite common in MI cases. All right. Don't forget to see our PLAB, hot videos. Like there are like 150 topics actually. Please make sure you see that actually. So post MI is one of those important ones. A 40-year man presents with a bone pain, laboratory showing ALP is high. This is an easy peasy question. Phosphate level normal. What is the most likely diagnosis, guys? What do you think? I know you can answer this one. 40-year presents with a bony pain. Alkaline phosphate is high. I don't want to see anything. I just want correct answers from you guys. So this is the answer. What do you think? So high chances. for this condition because high alkaline phosphate is a very characteristic feature of Paget. We know that question is little incomplete. I'm expecting bone pain. They might also say bone deformity, and also more features would be given, not only bone pain, because this particular thing, also looks like to me multiple myeloma as well. But multiple myeloma is more common in elderly age group, like after 50. And multiple myeloma, there are mnemonic like, old crab. Do remember this mnemonic actually, old crab, like in elderly age group, back pain, then calcium level would be high, renal impairment would be there, anemia would be there, bone pain would be there. Okay, so those particular things, and also this calcium level and all these things, you need to keep it in mind. And this anemia would be normocytic normochromic anemia in multiple myeloma. Okay, so there's some differentiating point. Whereas not only bone pain, but bone deformity is very characteristically given in the exam actually for Paget's disease. Clear, everyone? Okay, I hope that's clear. Now, few pictures. Pictures always create some impression in the brain. In case of Paget, they might also tell you if elderly person does not hear properly these days. This is how question often started. So doesn't hear properly these days, and some changes in the faces, changes in the legs. These are more common actually. Paget's disease actually, Paget's disease of the bone actually. Okay, so a lot of it's become like a chalk. So more calcification. So characteristic feature, high alkaline phosphate is the feature. Now, what if some people think osteomalacia? I saw some of you writing osteomalacia. That was a closed DD. So in that particular case, what you are expecting actually, that calcium level you are expecting low, phosphate level would be low. In our case today, phosphate level was normal. So in Paget's, phosphate level usually normal. Okay, but in osteoporosis, calcium phosphate, alkaline, all are kind of normal. Some cases in osteomalacia, calcium low, phosphate low, alkaline phosphate can be high, but phosphate level would be no. This is a very important differentiating point, Paget's versus osteomalacia. Okay. Clear, everyone? Moving forward. Question 13, 8-year boy has a fever for 5 days and generalized maculopapular rash, very popular in the exam, telling you with a peeling of skin of the hand and feet, oral lesions are also present. The child also has a red eyes. What is the single likely diagnosis? First, tell me what is the diagnosis here. Yeah, I think they ask you the diagnosis. Some cases investigation will come to. So I think you don't need much information. So so fever for 5 days, then first fever, then comes the rash, oral lesion present, eye lesions present. I don't see any point of choosing hand, foot, mouth disease, which is extremely rare in that case. So this is nothing but very classic Kawasaki disease. Now, why some of you choose, hand, foot, mouth disease? I really don't get it, because peeling of skin is also mentioned here. Because it is this peeling of skin is called what? It is called 𝗕squamation. Please remember and write this term. This is often given, this particular term. They don't write 𝗕squamation, they write peeling of the skin of the hand and feet. Peeling of the skin of the hand and feet. And fever, after fever, then that rash appears. This is another characteristics of this Kawasaki disease actually. So fever for more than 5 days. All right, 5 or more than 5 days, and 4 out of these 5, any one of them is present actually. Often the same question can be tested as they give you this scenario and they'll ask you about investigation. So initial investigation would be in the down bottom, if you see ESR and how to confirm is an echo. Right? More information about the Kawasaki. Pictures always create a lot of impressions. So eye feature, this tongue feature, okay, this 𝗕squamation feature. And also remember Kawasaki. How many of you know Kawasaki is a bike? I hope so. All of you, we know Kawasaki. There is a very popular bike out there actually, right? Kawasaki bike actually. People used to ride this Kawasaki bike actually. Now it is quite expensive actually. All right. So someone is sitting on a Kawasaki bike, red tongue, temperature is high. Let me zoom this picture. It's Yeah, so temperature high, uh, dot in the face, sitting on a Kawasaki. Kawasaki bike is this type of green color. You can Google it. And also, it's small green color in the neck. That means lymphadenopathy. And lymph node size are more than 1.5 centimeter. These are characteristics. And someday you will go to the clinical exam or part 2 exam. You need to know this information that, on examination, you ask the role player, may I know the size of the lymph node actually. I'll appreciate if you tell me the size of the lymph node actually. So in that case, they'll tell you actually. So these informations are important actually. All right. Okay. All right, guys. So what we will do, guys, we'll take a I think let's see the time today. It's I think Ramadan and things are going on. Going to continue a little bit more actually. How things are going on in your side, let us know. Hope you're enjoying. I mean, we'd like to give you a little demonstration now on the contents, how the contents looks like. Those of you have joined, will see the contents right now. So I'm just taking a second just to show you how the contents looks like actually. I'm just taking you in a minute. I'll just take you there actually. Yeah. All right. Now, mostly those of you are joining our PLAB recall. Like now, what I like to give you some task actually. If necessary, I can take one day more. That's not a problem. The classes actually, but very clear instructions are very, very important. So when you open our folder, you will find folders like this actually. Now, if you see these particular things actually, I'm really sorry, my dear, power cuts are going on actually, yeah, that is true. I have a like, maybe central line with a power backup. That's why, so sorry to hear about you. Great. Yes. Yeah, no problem. No problem, my dear. Thank you so much for joining. Let me just give you the quick demonstration. No worries, as I mentioned, I know I'm not a person that hesitate to take extra classes, things like that. But very important. You are in the right track actually. So what is something you are going to do today? If I don't take too much today, so what you need to do, those of you are new. So if you find this PLAB hot topics actually, so you see like, a lot of 50, 50, 50. So 150 hot topics. So you can finish it now, or when you finish the recall session, then you can do it actually. This is first option actually. All right. So this is very important. One more we might add this time actually, because some new hot topics came up. We thought like, of taking classes on them as well. Now, this is first thing. Now, important thing is going on where you will find the 2023 February, which is we started taking classes. So files and things will be available here. More files are coming, will be available here soon. Now, let me take you to because 2023 just 1 month exam has happened, but 2022 has many months of exam being tested. Right now, you see that it's like in 2020 like this will be November actually. I'll rename this as a November. No problem. Now you see this like February 2022. When you enter, there will be a lot of files and the videos actually. So usually in a particular for a month, we take 2 or 3 classes. So all these particular files and things are given. So your job, my dear, is today to open the 2022 folder. We start with the February. Start with the February. So you should grab everything now. So February you should start. Then what you should do, then go to the May. I don't think so you'll get much time. And guys, every moment is important from now on actually. So today I would say at least finish February 2022. Tomorrow after class you can finish the May 2022. You see another 2 3 videos, and the files and things are given. Very difficult to finish in quick time. Then you can go to the August. Yeah, you can see the files in the August and things are given. And also this is in this November things, you can also see actually. Right, I'll just rename this one actually shortly. And then you come, maybe when our classes. So while doing the class, I want you to finish 2022. I repeat, the plan to be like, I'm talking about the May candidates actually. If you are an August candidate, you have a lot of time actually, but still like you need to speed up. what we see then in last 15-day candidates try to give maximum effort. No, exam is becoming difficult. So guys, very, very important that you start giving the best effort. You fail and your next date will be much dead. Now you have to ask different people. Some people we saw asking and trying to give money for a, you know, replacing seat and things like that. So we don't want you to go through that, drag down to that difficult part. Now, PLAB 2021, after finishing this 4 5 days session, you jumped into 2021. Then you see February, May, August. Let's see, let's click any one of them. Let's click this on February. You see again, many files and things are given. All right, so you can go on, so a lot of things are there. So this video icons are for video, the small icons are for, so let's click one of them, how it looks like actually. So this is how, like, say, this is how it looks like. All right, so this is how it looks like. So you go and start going and start finishing one by one by one. All right, so you can just finish very easily. So you see, like, it's very well organized. I've been a tutor for 6 7 years, so you can trust on me on these things. That file quality would be extremely standard. All right, so these are certain way of things are given. Then if you come, same goes. Let's click the August. Yeah, August has also a lot of informations and videos and the files. So every month you go, you see there's 4 particular months. Even if I take you to the 2020. Again, the same thing, a lot of uh, March, June, October. Yeah, so all of these things are given. All right. Also, it's one more important thing. I personally found that many of you are, I mean, don't get offensive, like, telling this, that, your psychiatry knowledge, what we learn, same goes with me. When I just came up as a fresh, my psychiatry knowledge is not up to that much, because we don't have a psychiatry board in our med school. We have a medicine board, we have a pediatric board. We were a bit good with the medicine pediatrics. So most of you understand you are not much good with the psychiatry. So in that case, you need to see this psychiatry, go to that psychiatry and go to psychiatry 2022 classes. And please, my humble request, you at least see psychiatry theory 1, theory 2, and theory 3. Okay, recall, you don't need probably at this time, but psychiatry theory 1, theory 2, theory 3, this will give you an assurance that you can at least grab the question. Otherwise, PLAB 1 keys, PLABable won't gonna work actually for you in the main exam. All right, unless you have a good psychiatry background. Actually, I don't know your medical college, it depends on the tutors as well. But most of the medicals I'm talking about, in some of the Bangladesh medicals, it's not that. Even same happens with me actually in my medical, that psychiatry, maybe we don't learn in that way. Maybe teachers are giving, we don't learn in that way because we don't have a medical board separately on psychiatry. Okay, so my humble request, psychiatry theory 1, theory 2, theory 3, especially the psychiatry theory on class drug 3, very, very important, must see it actually. Okay, all psychiatric drug related confusion will be cleared actually. All right, so this is how you need to finish at least 4 year. Those are exam candidates, at least 4 year. I'm telling you, also finish psychiatry 4 videos. At least, there's theory 1, theory 2, theory, and the psychotherapy, new questions coming around psychotherapy. You can also see that. Then you can also go with the PLAB hot topics. Make sure you see this 150 topics, very, very important. My classes are also there. Dr. Shumon is, which have another tutor for PLAB 1. So his some of the classes are also available here actually. All right. Dr. Shumon is this time little busy. He just joined NHS actually, but I'll try ask him if he can, borrow his time for one more class. And last but not the least is like a mock test actually. So mock test will give you guide you on the last day, how to take a mock test and the thing, but it's given there. You don't need to see that one now actually. You can see it later. Okay, so this is the demonstration on this thing. And before we go, as I mentioned, today we're not expending too much, just to keep the energies and things for you and make. But today, you guys don't leave. You guys better go to the drive and start watching them actually. Now, this is that routine we mentioning. Those of you joined little late, we have been doing 17. Tomorrow, I will take another one, 18, then 19, 20, 21. Okay, so we'll be taking the latest one actually, and the recordings will be given of the previous. That is how we been designing so far. Success rate, mashallah, it's like, I found 95% till that. This is honest, to be honest, actually. All right. So, exactly, you just need to follow. If you have gone through PLAB1, please PLABable, I would definitely recommend you to also keep revising that one. But please, my dear doctors, humble request, give a shot with the recalls as well, actually. Okay, why to take risk? With the exam is not too difficult, actually, but sometimes it's just we take it too lightly. You have that knowledge and talent, you have come up with very difficult MBBS, so many creepy teachers and things like that, but you can also definitely do it. But make sure you don't get stuck with the PLAB one. Actually, your morale would be very down before PLAB 2 in that case. Actually, you see most of them will pass and some of you will be left over, and you are not getting date in 6 months, 8 months. It would be very difficult for you in that case. Okay, so 17, 18, 19, 20, 21. If you are a candidate of a November, no problem, you can still join. Then there would be another session in the July, another session would be in October. You can join that. If your exam is in 2024, doesn't matter, you can join. Many joined us before, their exam is later, they just keep doing the classes, actually, so not a problem. All right, so thank you. I think today I'll just cut short a little bit, but tomorrow I'll catch up with a more longer session, actually. So be ready for that one. And today, don't leave the class. I mean, you leave the class, but you enter into the drive and start playing with it. Get familiar with that one. Next day, ask me question on that one. All right. I hope so. That is clear to the dear doctors. Hope so. You guys enjoyed, whatever you saw. I just hope you enjoyed, like just minimal what I tried to display earlier. I just hope you enjoyed. Please let me know in the comment section if you have enjoyed that session, what we just took, actually. And it's more like a trial today. Yeah, but tomorrow would be more bigger session coming up, actually. Thank you so much. You can share this video with your friends. Actually, it's already in our YouTube channel. And YouTube, you might find this one very easily. Um, that uh, this is the name of the YouTube. Please subscribe if you haven't. If you're not joining, that's also okay. You might find 2 or 3 videos are already given there. You can search with PLAB recall Shahriar Ahmed Shujo. If you search with this name, you may find few pre-recall classes as well. If you're not joining, that's also okay. Knowledge is for sharing what you believe. So I think thank you so much, guys. I'll catch up with a longer session. Get ready for tomorrow 3-hour session, actually. All right. So please make sure, because long list of questions are coming next day. But today, those already subscribed, you please enter, I'm telling again, and please check with the 2022 February. Can you do that for me? Thank you so much, guys. Okay, so see you all. See you all next time in the next day. And thank you so much. Actually, if anyone wants to add your microphone and tell anything, that's also fine. Or otherwise, we'll see you tomorrow, actually, with another class, actually. So good luck. Good night. See you tomorrow, actually.